Your Business, where you're invited on the air to tell us what makes your business stand out in the community. It's important we hear from you to tell us all we need to know about what you do best. Tell Us Your Business uses the latest radio and television production systems, and all shows can be seen on amp2.tv. If you have a question for our guest, call 888-565-1470. Now, let's get ready as our guest hits the airwaves and informs us about what we need to know on Tell Us Your Business.
Welcome to Tell Us Your Business. I am Dr. Liz Perry with Perry Family Health, and I'm sitting here with Drew Shankles, who's involved in DNA testing.
Hello.
Hi.
Hey, Dr. Perry. Thank you so much for having me on.
Thanks for being here. It's great to talk a little bit about integrative medicine with somebody like yourself. I think as the world is changing, we're in a consumer-based medical world, and so proud to be participatory with all that with you. So why don't we, let me just start off by introducing a little bit who I am, Perry Family Health, and then I want to toss the baton over to you and have you kind of talk about genetic testing and how they all work together to help people live longer, healthier, more vital lives.
Sure.
Okay, cool. So basically, I'm Dr. Perry with Perry Family Health. We're proud to be here in the Palm Beach County area, and we are a full family practice of integrative medicine that provides you and your family, whether you're geriatrics, pediatrics, or anywhere in the middle, with optimizing both biomedicine as well as traditional Chinese medicine. How about that? So we're out here to try to just teach and educate the consumers here in the Palm Beach area about how to optimize your life. How can you be the best you that you can be using preventative medicine and treating disease with many different venues that are available to you besides just medication and surgery, which sometimes are very important. Now, Drew, you are involved in the DNA testing. Can you tell folks about how important that is with integrative medicine and prevention? And let's share with folks, please, a little bit more about who you are, sort of what you do, and how you can help.
Sure. Again, my name is Drew Shankles. I'm with Genetics Network. We provide a variety of different type of genetic and molecular testing to healthcare providers here in South Florida and across the nation. We have a nationwide network of genetic and molecular labs, some here in West Palm Beach, some in Atlanta and New Orleans. And what we do, again, is provide this genetic testing, which gives physicians such as yourself, Dr. Perry, the valuable knowledge to make diagnosis, treatment decisions, and to be able to treat a patient based on a more personalized level, including the individual's, genomic profile information and everything else that you consider when looking at long-term health care.
I love it and proud to know you. And let's just tell folks out there that may or may not be super familiar with DNA testing, which is the same thing as genetic testing. Like for example, how you can prevent lives and save lives. So talk about maybe like your two flagship tests that people can give us a call at Perry Family Health to come on into our clinic, and insurance pays for it too right now.
Yeah, they do.
So this is really good stuff. So Drew, if you could just share please with folks a little bit about the two key flagships and then maybe talk about that.
Sure. So the two main type of genetic testing that we do, which is a type of medical test that analyzes a patient's DNA, specifically for what's commonly called mutations, but is also referred to as pathogenic variances. One is cancer genomics, which is commonly referred to as hereditary cancer screening. Now, what that does is analyzes a patient's DNA for mutations that have a known association with an increased risk of developing cancer. So basically that test, the hereditary cancer screening, predicts risk. Now that's all it is just risk. Just because someone carries a mutation does not mean that they're going to actually develop anything near that cancer. Mm-hmm. But what it does is it allows physicians like yourself to be able to do more screening or to be able to utilize prevention techniques and methodologies to prevent from the disease from even occurring, to reduce risk, as well as early detection when the disease is much more treatable and the long-term healthcare outcomes for the patient.
I love it. Thank you, Drew. I mean, that is just amazing. So people can call us at Perry Family Health and make an appointment with us to get your genetic testing done to help prevent, to find out if they're available, if their insurance will pay, which most of the time it does. You meet a certain criteria. Can you just talk quickly about the criteria
Sure.
patient has to meet in order to get the insurance to pay for their DNA testing for the 2 flagships?
Sure. Now, I've worked personally with hundreds of patients myself, as well as with many physicians who offer this sort of testing to their patients. And what I tell everybody, from patients to the physicians I consult with, is if you have a personal history of cancer or a family history of cancer, it's always advisable to talk to somebody that offers this sort of testing, such as yourself, Dr. Perry, at Perry Family Practice, to see if it's appropriate, to see if it's something that's recommended. So if someone has a personal history or a family history of cancer and is concerned that there may be some sort of inheritable cancers within their family, then that's where we go at, and that's step 1. From there, we look and see if it's recommended and see if it's the insurance that covers it generally, if it's a commercial insurance, any PPOs.
Excellent,
And,
excellent. Yep.
No, that's it. And as well as traditional Medicare covers
And-
this as well.
Excellent, excellent. So both Medicare and a lot of the private pays, the managed care is starting to really step up in terms of coverage, which is essential to integrative medicine, and both with the Chinese medicine, acupuncture, herbs, the other modalities that Chinese medicine helps with to treat the patient's well-being, as well as the genetic DNA testing. This is wonderful. So consumers out there looking to optimize their own health and wellness, this is great information for you to know. So I wanted to just back up for just a minute. So if anybody wants to get any DNA genetic testing done with Drew Shankles through Perry Family Health, we are affiliates. We are integrative health. We're all about that, changing the healthcare system here in Palm Beach County, here in the United States. And you can call us to make your appointment today at 561-660-8511 to schedule an appointment to come on in, get evaluated, and get your genetic testing done. So beyond that, so how does, I wanted to talk a little bit about to the folks out there today, our listenership, about, so how does that help? Okay, so say we have a very high probability, a high risk of getting cancer of the breast or of the ovaries or of the prostate. Where do we go from here? We get the test back. We realize, we're high risk. We do not have the cancer yet. So what are our options? What do they look like? So that's one of the things that is very effective by integrative healthcare. So first they come to us. They get your testing, our testing through you and your group, which is awesome. And like I said, it's an honor to know you. It's a privilege to have you on board and your group working with us towards preventing disease. But once they find out that, gosh, there's a high risk involved here, where do we go from here? So one of the beauties is traditional Chinese medicine oftentimes can see the stagnation occurring with the cancer before it actually shows its ugly head to the actual laboratory. So we can see the stagnation, we can treat the stagnation through those meridians. Cancer in traditional Chinese medicine is either one or two things. It's either a blood stasis or it's a phlegm stasis. So either way, we treat very effectively to prevent this from moving forward once we know the person's highly subject to it as well, which we can often tell by our own diagnostics, but yours confirms it. So this is a very, very powerful way that alternative medicine with biomedicine continuously are working together today. They have been for thousands of years, and they will continue to in this country, in this area, in the United States, more and more powerfully all the time, from protocols that you offer and that we also offer as a united group, here at Perry Family Health. So very cool. And I don't know, I know that I had the pleasure of first meeting you, Drew. You came into us. We're proud. We just opened in January. We do treat all kinds of diseases. We treat golly, not only preventative cancer, we treat side effects from cancer. We certainly treat any kind of GI problems, women's health. We do a lot with fertility and actually do all kinds of things, whether it's migraine, pain management. We certainly do a lot with mental health, helping people with anxiety, depression, insomnia. I mean, really, the list goes on of what any GP or PCP would offer. We do very similarly with other modalities as well as the Western biomedicine. So you had come in, though, Drew, as preliminary as a patient. Is that
I did.
right?
Yes, I did.
Yeah, that's how I think we. And so tell me about that. We're in the same field. We've both been in the same field for decades now. But would you mind sharing our listenership a little bit about your own personal experience being, an expert in biomedicine? What did you share your experience with acupuncture and herbs in our clinic?
Yeah, well, first of all, let me say that it's an extreme honor not only to be a colleague but a patient of yours as well. Because
Thank you very much.
doing what I do with at the forefront of this new biotechnology movement in healthcare, looking at this integrated approach overall, utilizing the best of all the modalities available out there, it's a pleasure to work with you because I try to be quite honest with you, very selective with the physicians that I work with personally because I do wear a bunch of hats with genetics networks. But coming to you as a patient was quite a relief. I have a pretty extensive history within traditional Chinese medicine, and I am very pleased to say that it was quite fortuitous that we met because through your treatments I saw an increase just in overall vitality. Specifically with sleep, whereas the sleep I was getting was extremely poor. My energy level, which is notoriously my entire adult life, I've had issues with and troubles, and I've tried all sorts of approaches. And the specific treatments that you gave me as a patient, over multiple treatments, I saw just an enhanced and it was a very much increased. With every single treatment, I was able to see a dramatic increase in sleep and energy. You had worked on some aspects in terms of male health with me, which I saw a dramatic increase of, but the overall just strengthening of my constitution. And even when it came down to, and you spoke of anxiety and mental health, and I've had my own struggles with anxiety, with that sort of mental health issues, and have always looked at alternative medicine in addition to Western medicine, and being in biotechnology and in genetic testing, I'm pretty much a beast when it comes to research. I do what I see works, and also what I've seen work on myself, as well as I know what works within the clinical research, which is absolutely fascinating to be, not only a colleague, but a patient, because I've seen dramatic results in my own personal health, my own personal life.
Thank you, Drew. That's awesome. I'm thrilled because that's what warms my heart as a doctor and a healer is to get results. So to be very specific for folks that are out there that are like, well, I've thought about acupuncture. I'm not sure about it. Does it really work? Is it woo-woo? The reality is there's solid clinical science that shows all over the place on every aspect of medicine in many cases, not in every single case. And I'm happy to speak to that specifically. But so what I'm asking you, if you wouldn't mind, please, is like your sleep. When you came to me, I think you slept, can you just share with the audience, I slept maybe this many hours and it was broken. And then by the end of 14 treatments, I slept this many hours and it was a more solid, deeper sleep or what have you. Would you mind just elaborating a little bit more specific data so that they can clearly get metrics, results?
Definitely.
Just a high level overview.
Sure.
I know we didn't bring your chart with you or anything.
And a bit of background. When we met, I was in the process, along with my partners, with building genetics networks. I was extremely stressed, extremely busy, working all the time. It's something I've become absolutely passionate about. I was trying to squeeze in a very necessary, vital part of my life, sleep, into a very small amount of hours, and was doing a very poor job.
So how many
at it.
hours?
I was probably sleeping around 5 to 6.
Okay.
If I had
and then after the treatments?
After the treatments, I was sleeping a solid 7 or 8, which is really good for me.
Was it easier for you to fall asleep as well as stay asleep after the treatments?
Both. It was actually easier for me to fall asleep as well as I wasn't getting up throughout the night. that 7 or 8 hours.
And in terms of your energy level, sorry, I just want to
No,
kind
no,
of just
it's-
be specific so people can sort of see a clear
For sure.
measuring stick. I think that's important than just sort of being slightly ambiguous. So in terms of your energy level, when you came in, your energy level was, what would you say? Was it like
A scale of 1 to 10, I'd probably say it was around, well, actually around a 3 or 4.
and then after the 14 treatments that you came to Perry Family Health and got acupuncture treatments, what would you say it was?
It got up to around an 8, which is, again, this is something
And is that sustainable for you?
That's sustainable.
Okay.
That's the first in
And as
my
far
entire
as
adult life. So,
awesome, that's awesome.
Yeah, it is.
So
It's
that's
amazing.
really, really good stuff. And then, so for also your male health, in terms of your ability to just feel like your hormones perhaps are more balanced, you know, and that you're just a little bit more functioning that way. Would you say,
Yeah,
how
definitely.
like
I
on a
mean-
scale of 1 to 10, how much, just in general, how much percent would you say that?
I'd say the
overall?
percentage increase in vitality and in regards to that was at least a good 75 to 80%.
Okay, so that's huge. So
Very
thank you
much
very
so.
much for
Yeah.
sharing that. And I did want to make a brief statement here because I think it's a good time to just share with the audience. We are conducting clinical research studies at Perry Family Health right now on erectile dysfunction. So if anybody is interested in that sort of participation, normally those treatments would be between $200 and $300 a session times 14. Right now they're free. So you do need to meet a certain criteria, as you and I both know. If you know, but if people are interested in that, you know, give us a call at Perry Family Health and come on in to get started with a clinical research study. 561-660-8511. Now, one of the things, Drew, I'm really glad you're here because I wanted to share with you that, you know, you are a patient. You're also an expert in biomedicine, you know, working with genetics for years.
Right.
And what I would like to ask you, please, if I may, is being in the position and the professional that you are, can you please share what you might say to somebody out there that's on the fence about, well, you know, I'm tired of this back pain, or I'm tired of suffering from erectile dysfunction, or, you know, even if you're a lady and you have night sweats or bedwetting issue for a child, anyone out there who's contemplating about the possibility of trying Chinese medicine, acupuncture, the herbs, the electrostimulation, the cupping that can, we all know in sports medicine helps significantly. What would you say out there to somebody who's sort of on the fence or afraid of needles or afraid of taking a tea herb? What would you say to sort of maybe help them further digest their questions?
Well, I can say from personal experience, well, first of all, if you consider the alternatives with traditional approaches to certain conditions such as carpal tunnel, which I have seen personally, which the only option I was given was, the next option was surgical. Through acupuncture, I completely eliminated, or not I did, but my acupuncturist years ago completely eliminated all symptoms of carpal tunnel. I've never had a problem since. And the other
And were you
option-
afraid of needles at that time?
No, I was, I kind of got worked into it.
Okay.
But as soon as I had my first treatment, it was amazing. I was on the table, and I'm one of those people that gets completely relaxed. Mm-hmm. And so I'm tense at first, but yeah, they're going you know, another thing that I love about you is that as you do your treatment, as you begin, you do very well with working with each individual, at least with me, in terms of breathing in and allowing you to do what you do best. And it's absolutely phenomenal. And it's not the needle sort of stigma that you may have. And it's absolutely worth at least one try because...
Did you
know,
feel any pain when you had the acupuncture in our
No.
clinic?
No, not at all.
And I think most of our practitioners there are the same. Wouldn't you agree?
Yeah, very much.
So I think maybe we should invite a caller to, you know, some callers to call in and see if they have any questions or if they want to express any concern about, well, you know, I've been suffering from this ailment. If anybody out there is listening to us now that is suffering from any ailment that they just can't seem to get results, or maybe they can, but they're on the fence about where do I go from here? So having worked myself in the industry for nearly 30 years, nationally and internationally, as a doctor as well as a consultant with major health organizations, I'd be more than happy to perhaps give some guidance or certainly at least listen to your dilemmas. So you can give us a call here at the studio, 1-888-565-1470. That's 1-888-565-1470. And then between myself and you, we can maybe put the bow in the package to get people to take those next steps for optimal living. I think the slogan that we have at Perry Family Health is, Perry Family Health, where life becomes healthy living. And one of the reasons I think the group of us on our senior steering committee decided to name it that was because I have a great grandfather that was a famous and adored practitioner and an MD, a doctor back in Southern Mass. And to this day, people still, he's gone and come and gone from this planet, but people still say, oh, Dr. Perry, Dr. Perry. So he really was able to integrate the medicines to optimize people's health. And back in those days, when somebody had diabetes, they didn't have the wonderful laboratory examinations and the DNA testing that you now so beautifully provide for our practice and others. And, he would have to literally physically taste the urine of the child. And that would determine whether it was sweet or not, whether or not the child had diabetes. So there's lots of good stuff happening in the world of medicine today that, if used properly, can certainly very effectively help us.
And that's one thing I really enjoy about working with you is it truly is integrated with your volume of experience and knowledge, and both nationally and internationally. You're able to, I think, effectively convey and make sense out of what some people, it may be foreign concepts with traditional Chinese medicine.
Yes.
Because you're so well versed in healthcare and Western medicine and your background at Harvard and everything else that you have, you bring a lot to the table, which is, again, from where I sit within biotechnology and genetics, just to piggyback on what you were saying earlier about traditional Chinese medicine. The fact of the matter is, from where I sit, we're just now catching up to where traditional Chinese medicine has always been, which is absolutely fascinating to me.
Absolutely. Thank you so much, Drew. I really appreciate your thoughts on that, and I too have great respect for you. I think it's necessary for us all out there to work together. It's not about one modality or another. It's about optimizing all of them. So in approximately 65% of the world, you'll go to the hospital or the doctor's office or wherever you go to have any type of a treatment in the Far East, and you'll see a TCM doctor, which would stand for traditional Chinese medical doctor, as well as an MD, a medical doctor, and they work in alignment towards the shared goal to fix the patient, to optimize the patient's treatment, to help them get well, recover from whatever pathology that they're suffering from, whether it's an acute or chronic or both. And that is where we need to be going here in the United States. So being right here, like I said, I know you feel the same way, but I'm just proud and honored to be part of the Palm Beach community. And we welcome this community to come in and get involved and get evaluated. We will give a complimentary consultation at Perry Family Health. We do a free tongue and pulse analysis, and then you can go ahead and book your appointments from there and get your genetic testing. Drew will take good care of you, along with Perry Family Health. And I think it's a movement. We're just simply part of this great movement, and it's exciting. It's like, hey, by the way, didn't you tell me before you sailed around the world or something like that?
It's been a good bit of time in the South Pacific, so I think we both bring a lot of different experiences, and it's amazing to have you with your background here, right here, in Palm Beach County. And like I said, we work. I specifically work across the country. I'll be going out of state very soon once again, but we're based right here out of
excellent. Good to know.
Out of South Florida. So to have this here, to have this accessibility, and all through you and your associates through Perry Family Health is just a fascinating opportunity that I encourage anybody listening, if they get a chance, just to call and go in and take Dr. Perry up on her offer of an initial consultation.
Yeah, thank you. And, it's funny, when people do think about, healthcare, sometimes they get scared and uncomfortable. We want it to be more of a wellness experience, like whether or not we're at the beginning, middle, or end of our lives. We are all born, we all live, and we all die. But let's optimize our time spent here on the planet. And, being a member of the human species really is an honor and a privilege. So I think one of the goals we have is in that process from birth to death on this planet, like, let's make sure that we use it wisely. And so how do we do that? We do it through the right, using integrative healthcare, mind, body, and soul, from mental health to physical well-being. A lot of times people, I think, they think of like a chiropractor or an acupuncture physician as somebody who treats pain, which indeed they both do. I know, certainly the true core training of an acupuncture physician is internal medicine. So whether it's an acute situation like a cold and flu, whether it's a spider bite, whether it's an immediate Lyme disease infection, or some sort of a meat allergy, or whether it's a chronic long-term cancer or Crohn's disease, traditional Chinese medicine does treat and certainly help along with side effects with the cancer specifically, but also treats very effectively GI disorders, IBS, migraine headaches, so many things that a lot of us don't even know or think about. So anyway, I know that was an earful, right, Drew? I'm
No,
like
it's
trying to stop a freight
beautifully-
train.
no,
I
that's-
realize that.
That's beautifully put. And it is, again, one thing I respect about you is your acknowledgement of the various aspects of medicine, including acupuncture. But there is a place for all the modalities within integrated health.
Very good. So I don't know. Is anybody going to call us on the phone and ask a question? Okay. Well, feel free to ask a question, Drew.
Sure. Okay.
Okay.
Now, this study you're speaking of, when is that going to start up? Or have you already got everything compiled and you're looking for people? Or?
Yes, we are looking for people, and it is an incredible opportunity. It's for male erectile dysfunction, so they can just call. We're taking patients right away for applicants, 561-660-8511, and that would be great. It's a very harmless procedure. It's about 25 minutes for 14 sessions. The patients would have to commit to that, but it's actually a wonderful experience. And I think that anybody who has any questions or is interested, normally it's $200-300 treatment each session. So it's a huge savings. It will improve your quality of life. And we would welcome you reaching out to talk to us.
It'd be a beautiful introduction to acupuncture as well.
Okay. Hey, thanks so much. This has really been a pleasure being here on the show. And we love being on the show. And thanks so much.
Thank you.
This has been Tell Us Your Business, where a special guest comes on every week and tells us what they do. All shows can be seen on amp2.tv, and if you wish to be a guest, call 866-224-5422 and tell us about your business. That's 866-224-5422. This has been an amp2.tv production. The opinion